I need to give you those lists. Organ. Let me say I need that bigger. We need it to be bigger. Can you make it any bigger? Like this, the projection area.
The projection area? That's the biggest. That's the biggest. Whose project is that? Ours? Yeah, it's ours.
One to have the biggest you can afford without disrupting our sitting arrangement. Tell drivers receipts. As they yesterday, you think receipts. No, me, I like sorting. I hope now I didn't forget. If you forgot, then you begin scratching the head. Maybe you learn. If you have my city. Minister, I don't know this.
That's okay. Switch off the right.
Where's my pull-up banner?
Just wait. I just had it to come and sit down.
The father says, you tell the others, it is a little part. Until you really got a little bit of you. Yes. You get it? I also want a list of the steering committee. One list of the steering committee. You don't know. That's the 07, 8, 9. Zero, 8, 9, 901. 901. Yes. I also need the list of the steering committee. Use steering committee.
you're almost welcome. Yeah, the different speeches will affirm to what I have just mentioned. I need to take note of we invited the presence of the clergy in the house. Dr. Peter? Yes, yeah, I needed to take note of that because our motto basically says for God and my country. And that means we always have to start with God, and then our country, the rest of the programs can always proceed. At least I take note of your recognition, sir. I know in a short while you'll grace this big event for this region. And once you commit us in the hands of God, we will have the event get started. Yes, we also expect our host, who is the Senior Executive Consultant, Moroto Regional Referral Hospital. He will be welcoming us here officially into this event, and definitely we have the representation of the Karamoja community that manages the Moroto region, which is chaired by the chairperson of the Hospital Management Board, and will be giving us key note speeches. We take note of the presence of the Ministry of Health top management, and we recognize the presence of the Commissioner in the House. Thank you so much for honoring the event and also keeping time. In a sense, we recognize and we appreciate you for that. And we also know different departments of Ministry of Health are also in the House, and we will take note to have that done. We also take note of the presence of the health development partners who are with us in the House, different partners, the UN family, the USAID family, we have the Irish aid, we have UK aid funded, and the other different partners, Italian funded, and yeah, many others, health development partners who made us and also made it very possible for us to be here. And so, before spending much of our time, I think I will be asking us to commit this event in the house of God, and so that we know God will be in charge of this as we take note of the different partners. I know the hospital director who will be here shortly. He's officiating another morning engagement, and so we're just trying to wait him briefly so that he gets us moving and rolling. Without spending much of our time, allow me to invite our clergy, the representation of is the one that's representing our place. You're welcome. You may introduce yourself and then you bless us.
Good morning. My name is granting safe journey mercies to everyone, even those who are yet traveling. We thank you because you are doing it for your glory. And we thank you for this very important meeting, planning and ensuring that your people are well. We pray in the name of Jesus that as we sit down, many aspects of the activities, we pray in the name of Jesus that you, our God, will bless this function and bless every idea that comes from you to help us move in the direction that pleases you, that helps your people, and that makes sure this region is healthy and people live according to your word, live long. We pray that those who are yet to come, their trouble and bring them safely. Thank you, good God. In Jesus' name we pray.
Amen.
Calvin, you have finally adequate for safety. That once everything is in the hands of God, the whole day is heavily graced by the presence of God. Thank you so much. Ladies and gentlemen, others, I would love to recognize the presence of our different guests who've come to honor and of the Karamoja Public Health Emergency Operation Center. With us, we have guests of different categories, and you all represent the core decision-making body of stakeholders that are responsible for the driving of the health agenda in this region, per se. Yeah, we take note of the increasing population and the recent census. The teams will be giving us quite a lot of deliberations. I expect us to raise your bar of expectations for this year, because we anticipate great fruits and great results. Ladies and gentlemen, the teams in your different may mix up a few protocols here and there. So this is the disclaimer that the order may not necessarily represent the real national structure also. But however, in the context of this, we want to recognize the politicians and then the religious leaders in the house. I think I need to start with our political team, the politicians in the house, and have the political leadership from the districts, the LC5, the mayor. One of the moderators, please pass on the microphone. And Moses, let us have another microphone. So I'm very rich, I have two of them. Okay.
Morning, Nagole Joseph Robot, my name is, I'm the district chairperson of that.
Felix Mato Chale is my name. Thank you.
Welcome. We have RRHs in the house from the different districts.
A very good morning, family. A very good morning, family.
Good morning.
Yeah, because I have to do it, because I've got no response, but I'm also excited that you have responded. My name is Honoria Agros, the RRPC for Middle District. Thank you so much. Good morning, everyone. My name is Okiria Ismail, the Resident District Commissioner of Karamoja District.
You're welcome. Thank you, RRPCs. I think we expect a number of them still on the way coming. We expected more LC5s and RRPCs. Yeah, thank you so much for keeping time and for being with us, gracing this occasion. You'll allow me first shift to the chief executive officers.
Good morning, ladies and Uyuku Chen Emmanuel is my name.
Good morning, James Zelijo Kumu, Kawana Park.
Good morning, Richard Madeta, my name is the Council.
Good morning, ladies and gentlemen. Kalisa Samuel Mutiro is my name, Chief Administrative Officer at the Stroke Government.
Good morning, gentlemen and ladies. Marunda Hussein, I am the Deputy Chief Administrative Officer, Karamoja District. Kasi Kutosi, Moroto RRH.
Thank you, the chief administrative officers in the house. Yeah, we said more. All the 9 districts should be will be represented in the course of this engagement. Yeah, ladies and gentlemen, permit me to shift to the religious fraternity briefly and recognize the religious leaders in the house. You have the bishops and the assistant secretaries in the house. Do we have? I think I had read the introduction of Reverend Carvin. Yes. The representation from the diocese. We have Moroto RRH and we have Karamoja RRH.
I already introduced myself. I'm the Assistant Health Coordinator of North Karamoja Diocese, Reverend Calvin RRH.
Morning, everyone, and welcome to Moroto. I'm Sister Divina Musine. I'm the Assistant Health Coordinator for Moroto Diocese. Welcome.
Thank you so much. We expect to have cultural leadership, cultural representation. Do we have?
Good morning, my friends. Hero Simon Peter Apollo, Chair in Karamoja Elders Association as a cultural institution.
Thank you so much. I told us apologies that I so you permit me to you permit me to have the mix. Yes, thank you so much. Yeah, I know we also have the representation of the consumers or the stakeholders of the region. So we have the hospital management board that govern the region represented across the district. So starting with the chairperson board and the team. Let me allow you to introduce your team in the house.
Morning, everybody. Board members, we are present at Keta Political Region. And we have there, which has it's about the Moroto Region of Hospital. You are all welcome to this meeting. Members, if you are present, can you get up on the news?
Good morning, Dr. Johnson Morocco, board member.
Good morning, everyone.
Hannah Jennifer Echat, Senior Principal Assistant Nursing Officer, Moroto.
Nalibe Sharif, member of Moroto Hospital and DHO Karamoja.
Okay, well, thank you. Thank you, hospital members, for representing and taking part of this occasion. Yeah, we also want to recognize the presence of the Ministry of Health top leadership in the House. We have the guest representing the Director General and Services. He's our chief guest. We also have the commissioners representing SCAP and the team. So allow me to request you to introduce your team in the House.
Thank you, Chair. Good morning, colleagues. I'm Dr. Maria John Baptiste, standing in for the Director General of Health Services, Ministry of Health, but I work as a Commissioner for Emergency Medical Services. Nice to be here. Maybe two officers, one I think is a little bit out, but can introduce himself.
Good morning, ladies and gentlemen. Just to introduce my name. I work as a senior health economist, SCAP department. SCAP is basically standards, compliance, and accreditation of patient care. And I have a colleague who just moved out, so I think when he returns, he will introduce himself. Thank you so much.
Thank you. Thank you so much, leaders. We also have the National Public Health Emergency Operations Center and One Health team in the House. Allow me to recognize you and also introduce yourself. Ladies and gentlemen, in our last joint review mission, there was a huge concern. We didn't have much representation from the Ministry of Health top management. And this year we had to enable much efforts to make sure we have the team. So you have the assurance, and that's why I needed to have the team introduce themselves so that you get settled here that all decision makers are in the House.
Thank you. Good morning, ladies and gentlemen. My name is Dr. David Mwamuzi. I work as a senior public health veterinary officer, and I also coordinate one of the activities in the Ministry of Health. Thank you very much.
Good morning, ladies and gentlemen. Milton Makova Waitaka is my name. I work with the Public Health Emergencies Operations Center and the Ministry of Health. I am here representing myself and also representing the Director, National Public Health Emergency Operations Center, Dr. Isama. Thank you.
Thank you so much, Vitaka. I will proceed to recognize the presence of the district health officers in the House. Districts, the DHOs in the House need to recognize the presence.
Good morning, everyone. My name is Dr. Peter Okwang, HOL.
Morning, everyone. My name is Dr. Tino Salome, DHO Abim. Thank you.
Good morning, I'm Dr. Charles Serena DHO Cotillo. I also coordinate the DHO's region.
Kanali Beshare DH of Karamoja. As you shift to the mic, Dr. Chala, please you take note of those who are not here. Thank you. Yeah, so I am counting on Dr. Chala to ensure the rest of the DHOs are in the house, since he's the lead and the head of the DHOs in the house. Ladies and gentlemen, let me also recognize the presence of the forces in the house. We have UPDF, and then we have the police. We have the RPC and the UPDF. Okay, we're still anticipating to have the baby in the house. Okay, I would love to shift to the health development partners in the house. But as I shift to the health development partners, the rest of the team from the regional referral hospital, Moroto Regional Referral Hospital, I see the presence of the senior executive consultant, Dr. Stephen Pande, I guess he's around with us. And thank you so much, Dr. Pande, for coming. The rest of the regional referral hospital team from Moroto Regional Referral Hospital. Can you pass the mic so that we recognize you? Who are the major hosts of this event?
Good morning, everyone. You're welcome. Thank you.
You are almost welcome. I'm Alea Angela Vicky from Community Health Department. Thank you.
Good morning. I'm Dr. Charles Sabinyo Wandui, the head of Public Health Department, Moroto Regional Referral Hospital. You're welcome.
Charles is the one hosting us here, is Community Health Department activity. Yeah, so thank you for steering the leadership and making sure we teams.
Thank you so much. My name is Mark Lord, the Vice Physician, Moroto Regional Referral Hospital. Thank you.
So much. Good morning. I'm Musa Kukudi. I'm the Regional Emergency Coordinator for Karamoja Sub-Region.
Yeah, he's the man in charge of your ambulances.
So, good morning. Benedict Olowo is my name. I'm the IT officer for the Moroto Regional Referral Hospital.
Thank you.
Okay. Good morning, everyone. Anna Jennifer Echans, Senior Principal Assistant Nursing Officer, Moroto Regional Referral Hospital.
Good morning. I'm Ruth Ayeros, Public Health Officer, Moroto Regional Referral Hospital. Thank you.
Good morning. I'm Joyce Mana, Registry, Moroto.
Good morning. Helen Ajala is my name. Community Health Department, Moroto Regional Referral Hospital.
And myself, Okulum Moses, the Senior Medical Records Officer.
Thank you, the Regional Referral Hospital team. Take note of that. As you recognize that, I take note of the presence of the ADHO, maternal child health in the house. ADHOs in the house.
Morning, Natalie Slona is my name, Edition and Latuko.
Thank you.
Good morning, members. I'm a job Jane,
ADHO, LCH, Karina District. Thank you.
Good morning, all. I check guest is my name, ADHO founder.
Thank you so much, ADHOs in the house. Ladies and gentlemen, I'll shift to health development partners in the house. And we have the USAID team. And then I know some of them will be on call, I think, live with us. But we have the USAID funded family in the house. I think I was starting those categories. And we'll start with the Uganda Health Activity team. I recognize the presence of the Deputy Chief Uganda Health Activity.
Good morning. I'm Dr. Robert Eliso. I work as a Deputy Chief of Party, representing the Chief of Party USAID Uganda Health Activity. Thank you.
Good morning. My name is Dr. Andrew Chero. I'm the One Health team lead and also the Regional Program Director for the Valley region for USAID Uganda Health Activity.
Good morning, I'm Rogers Twesty. I work for Uganda Health Activity as a Senior System Strengthening Advisor. I'm based in Moroto. Thank you.
CAH team, UHA has heavily funded this event, and we appreciate you for the great support.
Samson Arara is my name, IT Assets Officer at CAH.
Thank you. Second microphone.
Good morning, ladies and gentlemen. My name is Godfrey Mina. I work with USAID Uganda, based in Moroto as an advisor for integrated health services delivery.
Good morning, all. Alan Kiprop is my name. I'm the Regional Quality Improvement Officer for Karamoja. I sit at the Public Health Department of Regional Referral, seconded there by my activity. Welcome.
Good morning, all. Joseph Chiku, the Regional Program Director, USAID Uganda Health Activity Karamoja.
Thank you, UHA team, for addressing this occasion and supporting.
Good morning. My name is Modas Serugobul, the Communications and Knowledge Management Specialist.
Thank you. Thank you so much, UHA. Definitely, there is they say to the hospital sweating activity, which is the government to government. So we are also Ministry of Health at the same time with the implementing plan. So we mixed. So I represent that. My name is Dr. Kurt Bryan, the project coordinator for the GGG activity. With us, we have PMI, Presidential Malaria Initiative. We have PMI, Presidential Malaria, which is implemented. The activity is called Malaria Reduction Activity, implemented by JSI. You're welcome.
Thank you very much. Mike Mukirani. I work as the health system strengthening advisor for PMI, Malaria Reduction Activity. I sit in Kampala. I'm here in for the Chief of Party. You're most welcome. Thank you.
Good morning, everyone. I'm called Nabo Derek. I work as the Regional Program Coordinator and also M&E. I sit here in Moroto. Thank you so much.
Good morning, everyone. My name is Christine Mukod. the existing strengthening officer for Karamoja. I sit in Moroto, and I work in all the 9 districts. Thank you very much.
Thank you. PMI, we have local partner health services, Karamoja, represented by Anika. Okay, PMI, yes.
Good morning. My name is Angela Katel. I work with PMI malaria reduction activity.
Good morning. My name is Felix Manan Mongome. I work in evaluation learning officer, the President's Malaria Initiative, malaria reduction activity. Thank you.
Thank you. Malaria reduction activity, you made sure that we have this nice hotel facility. So we want to recognize your efforts in funding this activity. We appreciate you for that. And yeah, we proceed to local partner services, Karamoja, which is Aneka in the house.
Good morning, ladies and gentlemen. I am called Patrick Godfrey. I work for the USAID Local Partner Services, Karamoja. And I am representing the chief of party for today.
Good morning, team. My name is Samantha Nareda. I work for local partner on health services as a social event and communication specialist in City and Moroto.
Thank you, Just we recognize your well-level support. I think we enjoy those nice books on the table. You know, partner coordination has been at its best as we talk in Karamoja. Every partner has put something nice on the table this time. And we appreciate that. Yes.
Very good morning, ladies and gentlemen. My name is Irene Mildred Neumbe. I work with the USAID Local Partner Health Services Karamoja, implemented by Aneka. I am the continuous quality officer.
And also good work. Yes, we have local service delivery activity implemented by UPMB in the house. Thank you for bringing us the bishop, the faith leaders, our faith-based facilities.
Good morning, ladies and gentlemen. I'm called Dr. Peter Mikago. I work with USAID, LSDA, UPMB, that works with the PNFP supporting TB and HIV service delivery. I serve as the regional team lead. I support care and treatment.
Good morning, colleagues. My name is Alan Magara. I work as a regional MIE for the USAID LSD activity.
Okay, thank you. We have a program for accelerated control TB at Karamoja. Are we in the house? Okay, strengthening supply chain activity.
Thank you, Dr. Brian. John Wilberforce Mayoka. I work with USAID funded activity, strengthening supply chain systems activity. Is a technical specialist above science mechanism. You can refer to us closely as the faces of medicines in the country. Yes, and with me here, I have my colleague. I am the regional coordinator in the region, and I have with me my colleague here.
Thank you, John. Good morning, team. My name is Derek Okulu, and I work with John, the organization message, and I'm glad to be here. Thank you so much. I work as a regional technical officer.
Thank you. Let me observe for that. We have Save the Children.
Good morning, everyone.
John Matiso is my name. Representing the regional area manager, but I also manage a project called Courts Giving Ownership and Assets Stop Standing in Karamoja.
Thank you so much. You're giving us that is well, thank you, Save the Children. We take note of the UN family. We have exhausted the USAID family. We have the UN family in the house, starting from the UN needs, and you introduce the different agencies in the house.
Good morning, colleagues. My name is Christopher Ngwerume. I am the acting chief of field office for UNICEF Moroto Zonal Office.
Good morning, everyone. My name is Sophie Giovanna Kera. I work for the UN President Coordinator's Office, coordinating UN agencies in Karamoja and Eastern.
Good morning. Program analyst.
Good morning, colleagues. My name is Richard Owundo. I work for UNICEF as a health officer and I'm based here in Moroto.
Okay, thank you to your family. Taking note of why food is not here. Okay, yeah, thank you. All nutrition issues. Now we take note of the other supported agencies and partners in the house, supported by the other different agencies. We have Malaria Consortium in the house. Malaria Consortium. Malaria Consortium is not yet in the house. Others, we appreciate and recognize them for facilitating the politicians in the house. When they come, they will represent. So we also have Quam in the house. We have Quam in the house. We also represent the ID.
Good morning, colleagues. I'm called Dr. Lilia Chai. I work with Quam as a program manager and I'm based here in Moroto. Good morning, colleagues. I'm Dr. Yoko Titima. I work with Quam as a project officer for One Health.
Morning, I'm Dr. Wadamyanto. I work as Public Health Officer.
Thank you so much, Quam. Do you have national medical stores in the house? Okay, I want to reiterate and reintroduce, do you have the, taking note of the district veterinary officer in the house, Sarah? Now, the deliberations in this house will interest you into some of the key stakeholders that we're bringing on board. That's why you're hearing a lot of One Health. And I know I do not want to preempt lots of discussions here. And definitely, the theme of this is we are strengthening public health systems for better health outcomes in Karamoja. And definitely we know what it entails. Do we have a security team now? The RRPC? The Regional Police Commander?
Thank you. Good morning, everyone. I'm Senior Superintendent of Police Godfrey Achilia. RRPC Chidepo. Chidepo is a BIM, Kotito, Kabong, and Karina. Thank you.
Thank you so much, RRPC. Do we have the UPD representation? Not yet here. Okay, the Mayor, Moroto. Okay, good.
Now, I will apologize in case I have left out a stakeholder. I will consultatively put you on my list in case I miss out any. Ladies and gentlemen, allow me I'll roll straight to the next agenda of today's engagement. And we will be looking at the overview of the program objectives of this current engagement. And this will be done by our host, the Senior Executive Consultant, Moroto Regional Referral Hospital, and also who goes as our chair and the lead of the Moroto Health Region. Yes, so we will be shifting to that. Okay, I'm also reminded to introduce Dr. Rosa Nego from the Catholic.
Good morning to everybody. I'm Dr. Sonigo. I'm the health advisor for Moroto Diocese. Thank you.
Yes, thank you. Thank you so much for being a stakeholder. So, ladies and gentlemen, let us proceed to the next. I will be recognizing the different stakeholders as we proceed to the different interludes. So, I will welcome the Senior Executive Consultant who will give us the objectives of this current engagement. And then at the same time, he will also welcome the Chairperson Board, who will also give us the brief remarks. And then yes. So, ladies and gentlemen, join hands and we are allowed and welcome Dr. Stephen Pandey. Thank you.
Let me observe the protocol to be established. I would like to first and foremost welcome all of you. This is very important meeting for Moroto Regional Referral Hospital as we do two very important activities. That's the joint review mission and the launch, the Public Health Emergencies Operation Center. I would like to appreciate or recognize your presence, Minister of Health, the guest of honor, our EB, our implementing partners, the district leadership, the body representatives present, and of course, the Moroto Regional Referral Hospital team represented by the top management of Moroto Regional Referral Hospital. Can you stand up for recognition? Wherever you are. Yes. Thank you. Also, at the same time, I'd like to recognize, appreciate the Community Health Department, the reason that we are here. Community Health Department of Moroto Regional Referral Hospital is yes. The thing that we are talking about is embedded in Community Health Department. So, ladies and gentlemen, I would like to once again welcome you to Moroto and Moroto Regional Referral Hospital. This very important activity. That's Karamoja Joint Review Mission, Public Health Emergencies Operation Center launch. on this day. The objectives of this 2 days program will run as follows. That is to review the progress of the implementation of the action points for the previous joint review mission, that's the ADM1, and also to review the performance of Moroto Regional Forest and the region as a whole. We want also to establish the contribution of key stakeholders in the healthcare delivery in the region. And we shall also agree on the regional priorities for the next financial year, that's 2024-25. And also to launch our baby, that's the Karamoja Public Health Emergencies Operations Center. So I would like to take you through briefly some of the key outputs on regional oversight, the Moroto Regional Forest. We have the maternal and child health interface with the region through the local maternal neonatal coordination structure. We also have an ambulance system supporting the entire region of 9 districts and 2 municipalities, which has really done a lot to improve on the survival in this region. Our ambulance services have reduced the mortality, and we also improving the number of the patients who access ambulance services within an hour. One thank this one to the commissioner, who is also our guest of honor, who has made it also that we have a well-established hub at regional level, which has also been established at the district level as our sub-hubs. We thank you so much. We have also regional capacity building of all carriers, regardless of your position, have been done. Skilling and the apprentice program, regional support supervision and mentorships, which has made us to reach all the districts, all the health facilities, hospitals, and all that through all means, both physical and virtual, using the ECHO programs, teleconferencing, such as the third line review, mental health integration, maternal perinatal health surveillance and review and response, and case conferences by consultants and training across different technical areas. This one I want to appreciate the region, our partners for the unwavering support. Regional stakeholders and partners coordination, review meetings such as performance reviews like this one, joint review mission and the partner coordination meetings has also been taken root. Karamoja Emergency Operations Center to enable us to respond, first of all, detect and respond to public health threats. This has been made possible by general support from our partners. Thank you so much. And of course, the people in the region, the team that are supporting the regional Public Health Emergency Operations Center are all here, ranging from the 3rd Division Commander, the Moroto Regional Hospital, the district representatives, and all that. So today is very important for us that we are launching this very important tool for us, which is going to enable us to detect and respond to public health threats. We will also provide provision of specialized medical services and referrals for all supported health facilities within the region. That's for all specialties, that is the pediatrics, child health, ophthalmology, obstetrics and gynecology, general surgery, ear, nose and throat, internal medicine, and medical radiology. We thank government of Uganda for having allocated to us a functional CT scan. So what are some of the notable successes that we have
registered within the period. Just to mention a few. Karamoja now celebrates above 90% reporting rates across the regions. All our districts are reporting over 90%, better than any other region in the country. Coupled with the weekly AP bulletins that we have championed in Moroto Regional Forest, we now have the bulletins which flash out every week. And I want to thank the editorial team for this. Who are the editorial team, please? The members of the editorial team. Dr. Coach, Sebunyo, Dr. Sebunyo, Sister here, and all the others. I appreciate it. The Public Health Emergencies Operations Center has so far supported the response to measles and anthrax outbreaks, which had ravaged the Moroto district and also Amodat. We have been able to contain this with the case fatality rate of less than 2%. Actually, in a place like this one, where our systems are not very developed, we would expect the case fatality rate to be as high as 6%. But we were able to contain, and we were able to avert death out of the measles. I want to thank you so much. Notable improvement in maternal and child health indicators. In terms of institutional deliveries, we have improved, almost tripling institutional deliveries, and also improved on maternal, reduction in maternal and perinatal deaths. I mean institutional. We still have a challenge in the community deaths and also deliveries. Those are the areas that we want to target going forward. We have also improved viral load suppression and retention of care and HIV and TB. Our case success, TB treatment success rate has improved greatly, and we also want to thank all the prayers, all the partners who have supported us. And I mentioned viral load suppression, which has also increased. Improved partner coordination and realization of sources for hub and spoke. We have a hub and spoke, which is anchored at the community health department in the hospital, and this goes down to place over coordination and bring the oversight role in the region. Improved ambulance coverage in the region. Thanks to the commissioner for allocating us additional ambulances to various districts and the regional referral hospital to improve on ambulance services. I think we need some JP here by a grab. Thank you so much. But despite that, we still need more. Like somebody said, we still need more to improve ambulance referral services in the region. Improve partner coordination. So we have embraced as a region, as a regional forest, we have embraced 5S and quality improvement. It is now a culture in the hospital and in the region. Everything, every item, every program is handled with the lens of quality improvement and 5S. So I don't have to say much of that because it is evident, because we have when the Ministry of Health did the assessment, Moroto Regional Forest Crop alone had improved greatly from just 49% to 69%. So I would like to acknowledge the following. First and foremost, Ministry of Health and all government actors who have made it possible for us to improve over the reporting period. We also, in the same way, thank the health development partners such as USAID, the US government, through the K2K strengthening activity, the Uganda health activity, ANECA, the local partner health services for Karamoja, the malaria reduction activity, PMI by DSCI. Also, local service delivery activity, UPMB, then program for accelerated control of TB, PACT in Karamoja by IDI. Social behavior change activity, SPCA. Uganda Health System strengthening, UHSS, and strengthening supply chain activity. Also, all those ones under USAID. MCH activity, Northwest activity, WESO. UN agencies, without forgetting with UN agencies like UNICEF, WHO, World Food Program, UNFPA, UN Women, among others. Other agencies include QUAM. We appreciate QUAM through the, from the Irish Embassy, Malaria, World Hunger, and Save the Children, World Vision, and Care Uganda. I would like to thank you very much for listening, and that must be end. Thank you very much.
Thank you so much, our senior executive consultant. Yeah, ladies and gentlemen, you need to get used to that title, the senior executive consultant. Moroto RRH. Thank you for hosting us and for welcoming us and for the remarks given. Ladies and gentlemen, those are the objectives aligned for this great occasion, leading us towards the theme of strengthening public health systems for better health outcomes in Karamoja. Ladies and gentlemen, health is in multi-sectoral approaches. That's why you're able to see a lot from different stakeholders, the security, the politicians, then we are shifting to One Health. You're hearing the word One Health, but we have experts who will give us more details. Without spending much of time, allow me to welcome the representation of the Hospital Management Board that also represents the consumer of health. In the process of the SEC giving the speech, we acknowledge more board members that came in. Yes, I think you will also see how to introduce your team. Yeah, thank you so much. And
good morning, everybody, once again. I'm with Ruze, chairperson of the Hospital Board. Maybe before I continue, may I first get my members present. Can you get a kindly? If you are board member, and I have so that's the team, part of the team, which is overseeing the regional hospital and the activities as far as health is concerned in the region of Karamoja. So we thank God for putting us there. And I also take this time to thank the Minister of Health, the Minister herself, for giving us another term. This is our second term to oversee the activities of the regional hospital. The Minister of Health in absence, and the Commissioner and the other top management Minister of Health, I present, recognize your presence and your trust in this regional activities, because you take care of your child. This is your child as a Minister of Health and top management. So whatever is you are seeing here, these are your fruits. So thank you for accepting to come. I take also this chance to welcome all the political organs present at your various levels. If you are present, please, we welcome you here. I also welcome all the technical team headed by the CAOs of various districts and the district health officers for various 9 districts of Karamoja. I wish also to welcome all the UN body, USA, religious leaders, cultural leaders, and please, if the ministers are here, expected the minister of Karamoja to be around. I hope I don't have pass name or her. All protocol observed. Allow me to say this. At Karamoja, as far as health services concerned, this is how far we've come. And when you look around, you can say that Commissioner Health is not an isolated activity. It is a multi-sectoral activity which brings out all players, and that is what is exhibited before us. You can hear veterinary, culture, all this multi-sectoral approach for us to achieve the health, smooth health of our clients in Karamoja. I wish to thank all the partners who have helped in mobilization, in planning, and putting all resources together to ensure that this takes place, these 2 activities take place. I remember last year we did not have the general review meeting because of the limited resources. And this year, I think we have seen many players which have come to see that this activity takes place. Thank you very much for whatever and whoever was able to bring out something to enable this function to take place. Let's clap for whoever did it. I wish also to thank the National Public Health Emergency team. If it is here, please you can stand for your recognition because you have brought us thus far. And through you, the team was able to nurture and mentor Karamoja team to produce a child called Karamoja Public Health Emergency Operations Center in the region. Under the guidance of Minister of Health, I think you can see that every time we meet the commissioner and the rest, every time we meet, there's something new. And that is a positive way we're moving. That every time you think about coming to Karamoja, in a second, you can see there's something new. And that is what we are focusing on, that something positive, not something negative. We're looking at how can we bring this Karamoja together to a standard which is required and which can be consumed by all. And we cannot do that alone. And this is what we are seeing here, that together we can. You remain alone, you cannot. So I also thank the Minister of Health under the guidance of the public health policy that The item 2, that inauguration of the Karamoja Public Health Emergency has a steering team. And if you are a member of that team, can you get up for recognition? Because you cannot run without a steering team. What you are going to launch today, there has a team from various districts of Karamoja. You will be surprised, this team, it has all the requirement, including the security organizers, the division commanders, other pieces, all those people. Because that is all looking at health. And you cannot deal with health when there is no security. So the security people, if you are here, the security organ, can you stand up for recognition? Because our operations as health workers in the regions, we cannot do without what? Without security. So we are always alert that any moment in the direction our team moves or wherever they are serving, there must be security. Security in our region is very paramount. It can be diseases, it can be raids, it can be floods, it can be fire, it can be anything. But you see, the team is always alert, foreseeing that this team really works 24 hours to see that all the clients, all the community is kept at all levels. I also wish to say the cultural leaders and the religious leaders, you play a lot of tasks to play as far as the health service delivery is concerned. That's why you find that you are in this house. Please, when you are here, the cultural leaders and the religious leaders, please, can you get up? And we recognize it. What you see here, we are all under your hands. The religious people and the cultural people. Because the population is at their disposal. You know better than the rest of us. And they usually consult you before. Whether it is on a Sunday, whether it is on a Friday, Saturday, call it. And whether you are at home at your chair under the tree, the community first starts with you. It starts with you because it goes to seek health services to the nearest hospital or nearest health center. That's why you here and you play a lot of work to ensure that our people are secure and we are all safe and benefit to the services which are brought to them. Because the services are not brought for anything, but they are brought before them. And it is through you that these services can be utilized by the community at hand. Today, I wish to say Karamoja is coming from far. Our commissioner will come from far, and I am delighted to say that at least the best thing the region has achieved is people are embracing education. And with education, we are starting to harvest. We have nurses, we have midwives, we have doctors, we have all categories of people, teachers and what. And I believe with time to become a model region for the other regions to learn from. That how is this Karamoja region performing? Because where we are coming, slowly but sure. That's what, any single achievement, we call it God, we call it a blessing from God. So we wish that God helps us to continue planting and harvesting something from what we're given. I wish also to almost finally saying that God is blessing us, and if you are seated here, when you get tired, and that will now need all the us, that though it is a small regional referral hospital, the services offered here for Ministry of Health, I would say, Moroto Regional Referral Hospital, I think it is, I'm not ashamed to say, it is the only hospital in Uganda who is offering services according to guidelines of the government of Uganda. And that shows why we are receiving, because of the services we offer, because of the technical people you have given us, we are receiving clients from all over Uganda, the whole of around Karamoja, including the 3 countries, that is Southern Sudan, Ethiopia, Kenya. This is their hospital. People come with the buses, the taxis. In the evening, you find them planning. Why are they coming? Just because of the services which is being offered by Moroto Regional Referral Hospital, and I believe you can clap for Moroto Regional Referral Hospital. It is a hospital where you are not going to get someone to say, give me something small so that I give you aspirin or Panadol or what. But they offer whatever is given, whatever National Medical Store is given, we give it. Without any taxing, without what. Apart from what we are guided by government like CT scan, they say you pay something like this, also pay but following the rightful procedure. So I wish to thank the government of Uganda for allowing this hospital to be there. And remember, it is supposed to offer specialist services. Unfortunately, because of the challenge the government has, it is not only offering specialized services because the lower health facilities, which are many health center tools and what are not upgraded. They are not upgraded to the rightful what. And that means most of the services people Moroto Regional Referral Hospital, which is not bad, but I think the government has a time to also improve that area so that we can do the needful. Finally, allow me to say that there is improved referral system in the region, and we should thank districts, that's the DHOs and cows who are there, that they have at least this less where their facilities, and that means in that and improve on that. Many things are being said, but I will allow me to say special thanks to all of you for God and my country.
Thank you, Chair, Hospital Management Board, for representing the Karamoja community that supports the regional referral hospital. Yeah, as she has given you a few contextual comments around Karamoja, I know we still have stakeholders here that will continue adding on to voice as our team from Ministry of Health were able to take note of that. I recognize more guests that came in. I know more DHOs came in. I also recognize the presence of the LC5 Cotido. Please let us recognize your presence, LC5 Cotido.
Who also serves as the spokesperson PLU.
Thank you so much. I think your voice was very loud and very clear. Yeah, he is representing PLU. Never know we will get more resources for help. Yeah, thank you. We also recognize the medical superintendent as St. Kizito Hospital, Matang. Thank you. St. Kizito is a big stakeholder in health, Karamoja region, and so we do not underestimate your presence. I know part of the board members that came in later, Salomok Paul, we recognize your presence. Yeah, I think which other, Dr. James Lamukol, the district that is hosting us. Dr. James, we recognize your presence. Thank you so much. It's our hosting DHO. Thank you for coming. Sister Asianat from ADHO Napak. Yes, thank you so much for coming. Yes, recognize your presence. So I'll be recognizing more the different stakeholders that will be coming in. Ladies and gentlemen, I would love to give time now to our Ministry of Health top management that is represented by the General Health Services to come and give us key remarks in the health sector. You're most welcome. Clap your hands.
Thank you so much, our MC, for everybody steering us. I stand here in the shoes of top management of Ministry of Health. I'm Dr. Wanya John Baptist Nambohe. I come to represent the Director of Health Services, Dr. Henry Professor. He was not able to be here due to another very critical assignment. So he asked me to come and be here. And when I reached, I realized that we don't have the big guns in the form of our honorable ministers, because I was informed the honorable minister of Karamoja will be taking charge. So I was asked now to stand in. You pray for me to fit in both the political and technical shoes of this meeting, because you are supposed to receive a statement from the political leadership, which with the powers that have been given, I will try to expose with the technical points. I also bring apologies from the Honorable Minister of Health, who had earlier on communicated to the team. We were with her in Bali in a similar event, but due to, as you know, what passed with different activities, she cannot be in all the regions. And in the same vein, the permanent secretary of Ministry of Health. So I stand here in their shoes. Protocol has already been late, but allow me to come that in honor of the board of the Moroto Regional Referral Hospital was already spoken here. The resident district commissioners, the district chairpersons, the chief administrative officers, the district health officers, the religious and cultural leaders of our team, the assistant coordinators, our development partners. There are various, I saw the list was reaching up to 10, but allow me specifically to cite the Uganda Health Activity, which hosted in Valley and also here for mobilizing all these partners to be here. I want also to recognize the UN agencies. I think I had UNICEF. I'm not sure whether WHO is within. Allow me also recognize the security. I don't know how the leadership flows, but let me say security, the UPDF, the police, the prisons, the local vigilant groups, all for the good job done. Yesterday when I kept communicating to the team, specifically Dr. Joseph, I was asking him, what time should I move, which is more secure? Then he told me, anytime is secure. I said, is this true? He confirmed. So I moved very, very comfortably in the night, and I kept meeting so many security officers, and that's why I'm very grateful. The last time I was here, I think about 3 years ago, immediately after we left, there was a problem. So I said we have escaped narrowly, but this time I've been assured that things are security for making sure that we are all here very comfortable. Thank you. Members, we do come here today to do the two major things. One is to review our performance, and the other one is to launch the Public Health Emergency Operations Center. Us gathering here as a regional team to look at our performance and plan for the future, it produces more results than when we all gather at the national level. Because here we are able to look at the things that exactly matter to the region. And you know, I appreciate the board chair has said Karamoja as a region has moved a lot of distance to where it is. I want to appreciate that. You saw from the senior executive consultant his submission, the achievements, which is summarized. I know we shall hear more, but I just want to thank you so much for the contributions so that now Karamoja is competing at par with other regions. I want to thank you. We can clap for the region. I want to say Karamoja again, as referenced by the body chair, is a border region. There are so many points of entry across this long stretch, and many countries, South Sudan, Ethiopia, Kenya, and I think others, all connect to Karamoja. And so it becomes critical that we are able to track the importation of diseases of public health importance. And the launch of the Public Health Emergency Operations Center gives us data ability for us to monitor and ensure that we are secure. Uganda lies in this great region, which is a hotspot for most of these highly infectious diseases. So the more organized we are, the better. I want to take this opportune time to really thank you that we have moved a great distance. You should not all forget the difficult times of COVID-19, the difficult times of the Ebola response. These were following each other. And I want to thank you. We worked together using the multi-sectorial approach to defeat these threats. Thank you so much. Our Honorable Minister and the team of top management were recognized globally, including His Excellency Yoweri Kaguta Museveni, for this approach to the COVID-19 pandemic specifically. As you all recall, it was a very difficult time. But you know, when you go through a difficult moment, and you realize at the end, when you are successful, you realize the decisions you are making are appreciated. It's a great step. And we are very grateful to our Honorable Minister who spent sleepless nights. And if you all followed, there are situations where people were so frustrated and they did not know that life is very difficult, and they thought everything is being caused by the minister. But she was very strong. I want you to appreciate her for standing. Members, the efforts you are putting in have borne fruits. The Uganda Demographic Health Survey is an impact assessment survey. It has shown us that whatever we are trying is not in vain. We are achieving a lot. The Uganda Demographic Health Survey indicated that the maternal mortality ratio has reduced from 336 to 189. That is more than, that's more than 100% reduction. You get it from 336 to 189. And when you look at the under 5 mortality rate, it is now, it reduced from over 100, I think, about 11 years ago, about 124 to now 52. Again, that is a major achievement. Even the infant mortality rate is now at 36. So, by and large, the efforts which various players put in have led us to make the change that we desire to make. The contribution, especially in institutional deliveries, the difficulties in Karamoja region in mothers accessing health facilities, but you saw from the senior executive consultant submission, all this has changed. We want to appreciate the frontline health workers for the changes that have taken place in the health sector positively. That notwithstanding, we still have a lot of work to do. As you know, we still have public health threats, disease outbreaks. You are seeing as we are trying to arrest the threat of mpox has come. And all this makes us be on the lookout. All the information has kept flowing from the Great Lakes region, Congo, then Kenya, West Africa, and so on. Finally, it is with us here in Uganda. Two days, no, a day ago, when I was being asked to have an evacuation of one of the positive cases from one of our private health facilities, I was seeing that we are going back again to the issue of running. We had to evacuate that case. We have now opened the isolation unit at Entebbe, and we are in that response. So that is why I'm saying that we should not sleep. We should not say we have achieved. The threats are still high. The teenage pregnancy rate is still quite high. The fertility rate per woman now is at 5.2. But you see, that is still work to do. We have got to do a lot to change that status quo so that we can achieve. We have been conducting integrated technical support supervision visits led by the permanent secretary and the director general to different regions. And the team was here in Karamoja region and recognized the difficulties they are in. When the executive consultant was talking about availability of the ambulances, when that integrated technical support supervision was conducted, I received the directives from the permanent secretary insisting the prioritization of Karamoja when we get any supplies. And that's why in 2023, we had got to supply some ambulances to this region. There are still gaps which we shall be able to address, but I am very happy that the little which is there is doing a great job. I will surprise you that despite of the difficulties in Karamoja, when we did the assessment for patients who need an ambulance and who actually receive it, Karamoja was the topmost. It is at 25%. The national average is 11%. But people who call, who have an emergency, desire to use an ambulance and actually get it. By 2023, it was 25% in Karamoja, which we are very grateful, and I would like to call upon you to sustain that momentum. When we get more, please utilize them. The actual problem with an ambulance service is that the resources which an ambulance uses can also be used elsewhere. And this is where the challenge is. And that's why you see that Karamoja is performing twice the other regions. Probably other regions are saying, no, we have put this PLS in the ambulance, but it has been put in the pickup. So when a patient calls, they have no fear to respond. But Karamoja seems to be on that positive trend. I have had instructions to ensure that we have a GPS tracking system so that it can help us to monitor the usage of our ambulances. And that's what we are going to do. We have got resources to that effect, and it is my wish that everybody will follow your example to ensure that we have a proper service going ahead. As I come to the end, I want to really appreciate all of you for turning up to honor this regional joint review mission. I want to really appreciate the government of Uganda for continuously prioritizing the health sector. Even if we have, we can say we have little money, but when you go on to look at grossly, you find that the health sector is always among the first four nationally in terms of funding. And that is direct government funding. Leaving alone that, we also, when we are appreciating these partners, we should know that, again, it is government which has brought these partners to serve you. So the input of the partners to ensure that we offer clear services, it means that the government has had a very positive discussion with them. And I want us to thank the partners who have made this contribution and their positive relationship with the government. With those remarks on behalf of the Director General of Health Services, Ministry of Health, and all the top management of the Ministry of Health, allow me to declare the third joint review mission of Karamoja region officially open.
Thank you so much, the Officer, the Director General of Services, and the person of the Commissioner. For those wonderful remarks, ladies and gentlemen, the third Karamoja Joint Review Mission has been declared open, and we want to take note of some of those successes that we are proud of as Karamoja. And thank you so much, stakeholders in the house. In one or the other, thank you so much for the stewardship, making sure that we're able to have such good ambulance services in the region. I normally tell people that I think Karamoja, in terms of health regions, I think it's the only region which has the widest diameter. You know, from here to Karena is 265. And then down to Karita, we talk about 195 or so kilometers. So driving from here to Karita is like you have driven 3 health regions there. So, and thank you so much for the support of the more ambulances in the region. Yeah, now that we've been declared, we want to take note of some accountabilities from the health development partners, and we'll be represented by the UN representation in the House. Let us welcome the representative from the UN family to give the inputs of the health development partners.
Thank you very much. The Director General, the Health Services, represented by the Commissioner for Emergency Medical Services, the Senior Executive Consultant of Moroto Regional Referral Hospital, the Commissioners that we have here, Minister of Health, Resident District Commissioners, District Chairpersons, Chief Administrative Officers, including the RFC, the Senior Management of the Police, the district health officers that we have, religious and cultural leaders, our fellow UN colleagues who are here, our development partners, including the USAID, the Irish Aid, and all other partners that are here that are helping in the health sector, all protocols observed. Good morning. Today, the theme of this important event, strengthening public health systems for better health outcomes in Karamoja, could not have come at a better time. And I think it befits the most critical moment in terms of our trajectory in ensuring public health in Karamoja region. As the Commissioner mentioned, we are gathered for the two purposes, to review on our key performance indicators for the health sector development plan for Karamoja, but also on the other hand to launch the Public Health Emergencies Operational Center. As we gather here today, the world is unprecedented public health emergencies, and this comes in the form of several pandemics that I think we have also noted here in Uganda and also in the Karamoja region. Climate change has actually triggered and also exacerbated these epidemics. The majority of the affected populations are children, as we know if we look at the demographics of the country. And also women who continue to face immense public health challenges, including communicable diseases, malnutrition, food insecurity, natural disasters that we have all noted here in Karamoja, including floods and droughts, that are driving high levels of maternal and newborn mortality. So we know that this region is quite unique in terms of some of these challenges that we are facing and the vulnerabilities that we note in the region. It is also important for us to note that the food insecurity crisis that this region has witnessed has also fueled other negative coping strategies that has seen an increase, as we have seen heard from the Commissioner's speech, increases in terms of child marriages, sexual exploitation and abuse, sexual and gender-based violence, which exposes our girls and women to the risk of HIV and other sexually transmitted diseases. The UN family in Karamoja is committed to working with the government of Uganda and all of you partners and colleagues in Karamoja region and the communities that we serve to strengthen health systems and services, improve access to quality health care, strengthen partnerships and coordination, to innovate and to leverage on technology. I think now with the introduction of artificial intelligence, there is a lot of opportunity for us to improve our health service delivery. As we come together to review performance, we need to also really appreciate the contributions of different stakeholders, our development partners that have really been very generous in supporting all the achievements that the Commissioner has just outlined for Karamoja. Also, the national and international NGOs that are working tirelessly. Also the local government system, the public health delivery system, and also the communities themselves who are, leading from the front to ensure that they maintain health within their respective communities. We should be able to find solutions for all these consistent challenges by scaling up the innovations that have yielded results. And I think as we gather and we review progress in this particular platform, this will allow us to really build on those results that we have achieved. We appreciate the collaborative efforts in the Karamoja region that have seen improved trends, as highlighted by Commissioner, in neonatal mortality. I think we are performing above the national standard or the national levels. Infant mortality, we are also performing above the national standard. Though we also recognize the need for us to work harder in order for us to continue to improve, particularly under 5 mortality, which is still under the national standard. And as we have heard in the beginning from the Commissioner's speech, Uganda faces serious risks in terms of public health. We definitely, at this point in time, are faced with a very huge risk of mpox, as he has highlighted. But we have also known that one of the biggest cases is malaria, so we shouldn't forget that. We also still continue to face the risks of cholera, measles, viral hemorrhagic fevers, and many other threats that come. Particularly, these are fueled by the region's vulnerability in terms of poor access to clean and safe water, poor access to sanitary facilities, malnutrition, which actually predispose children to all these diseases we've talked about, and the ever-increased risk that we have seen in these epidemic-prone diseases. Therefore, launching the Public Health Emergency Operational Center is a huge milestone for Karamoja region to help us to prepare, to analyze and to mitigate risks, to plan and to respond to public health emergencies in a timely manner. Therefore, as we sit for the next 2 days, let's share our expectations, our experiences. Let's share our, challenge ourselves to think more boldly, to act collaboratively, and to prioritize the most vulnerable communities and the most pressing needs, using appropriate innovations and technologies to achieve a healthier population. On behalf of the UN family, we would like to congratulate you in advance for the launch of the Karamoja Public Health Emergency Operational Center. Thank you very much. Ala Paranoid.
Thank you so much for the presentation from the UN family. The one is Karamoja is one. And this is also the one I learned. Yeah, thank you so much for those nice inputs, and we take note of those key themes that you've alluded to. And we also want to appreciate the partnership and the collaboration. And I think we have come from far when it comes to partner coordination. Karamoja is celebrated for having very many health development partners. But we are tending towards maturity when it comes to collaboration and leveraging resources. The successes take note of MOH and stakeholders is how we have collectively supported this engagement. Both mixed up from the UN family and also the USAID family and also Malaria Consortium.
each partner has put in resources, and we've also realized absence of duplication and with the stewardship of the regional referral hospital. So that's how it has come this far. And we want to continue harnessing on those efforts and see how far we can go. And thank you so much, you and family, for those key remarks. Ladies and gentlemen, I take note that the people came in early and really hungry, and we want to give us a health break, given the fact that our time is quite okay. Yeah, our time is fast spent, so we will be running through the program. So our health break should be taken very few minutes. And I know that our Reverend blessed us. I hope, I think the means were also blessed. And so we would love to request us to have very few minutes. That is about 15 minutes of the health break. And then we will come back, we will compete here with it. Yes, and where's the hotel? Derek, can you have the direction very fast for the guests, and so that we don't spend much of our time? We're going to have 15 minutes to have this break done, so that we rush through the program. So I beg to release us right now for a 15 minutes health break. But as that happens, we continue to recognize. I saw DHO Amodat around. Dr. Sagaki, thank you for coming. Yes, he's doing some